Welcome to another edition of This is Public Health, a podcast from the Illinois Department of Public Health. We're continuing our series of podcasts taking a deep dive into the main priorities laid out in the Healthy Illinois 2028 State Health Improvement Plan. This episode focuses on one of those main priorities, mental health and substance use disorder. Joining us for this discussion, Julia Strehlow, Senior Advisor to IDPH Director Dr. Samir Vora, and Melissa Stalets, Deputy Director at IDPH over the Office of Health Promotion. Thank you both so much for being here. We want to start by talking just about the fact that mental health is such an important subject, a main pillar of the State Health Improvement Plan, and really mental health ties in directly to every other aspect of health. If your mental health isn't good, it becomes much more difficult to maintain your physical health. IDPH works closely with a lot of state partners in this important subject. Melissa, I want to start with you to talk about the role that IDPH plays in mental health and how we work with our partners to promote better mental health.
Sure. Thanks, Jen. It's really nice to be here. I appreciate the opportunity to talk about the work that's happening in the Office of Health Promotion and in other areas of IDPH. So really, mental health work is woven throughout several offices at IDPH. The Office of Health Promotion does quite a bit of work in this area. We're very fortunate to have a few working advisory boards related to mental health and substance use disorder, including the Illinois Partnership for Safety and the Illinois Suicide Prevention Alliance, both of which are within the Office of Health Promotion. Each of these boards consists of members from state agencies and state partners. Over the past year, the Illinois Partnership for Safety and the Illinois Suicide Prevention Alliance have worked with our state partners to create webinars on mental health and suicide prevention and revising the injury prevention strategic plan. The Violence and Injury Prevention section was awarded the SAMHSA Garrett Lee Smith Grant. The 4 grantees are working on a number of activities, including depression screening for youth in Douglas County, establishing a roadmap for the referral process for families looking for mental health services for their children, providing training for clinical professionals working in child welfare, and creating post-prevention technical assistance and resources for youth, families, and community. The Violence and Injury Prevention section was awarded another grant by CDC titled Expanding Comprehensive Suicide Prevention Across the U.S. This grant focuses on reducing suicides among groups that are shown by morbidity and mortality data could be especially impacted. In accordance with CDC instructions, 2 groups have been identified. One, older men older than 50 in a subset of Illinois counties, and females aged 10 to 19. Grantees will initiate a number of programs targeted to the needs of these groups. In all these efforts, we're really fortunate to have strong partners and are very grateful for their contributions.
It is important to note that among the partners we work with, the Illinois Department of Human Services will be hearing from a representative of that agency a little bit later on in this program. We would note that substance use disorder is tied in with mental health in the State Health Improvement Plan. Julia Strehlow, Senior Advisor to Director Vora, let me ask you, why are these 2 issues so closely linked?
Yeah, thanks. That's a great question. And I'm also really happy to be here and happy to speak to all of the work that IDPH does on these subjects. Substance use disorder is a treatable mental disorder that affects a person's brain and behavior. Mental health tends to relate to the thoughts and feelings that we have and how those feelings and thoughts impact our lives. Often, people with substance use disorder may also have other mental health disorders, and people with mental health disorders may struggle with substance use. Sometimes people have both, but that doesn't mean that one caused the other. So they are related, but they're not necessarily always directly connected. Often the strategies that treat and mitigate the severity of mental health challenges and substance use disorders are very interconnected. Prevention and treatment of mental health issues can contribute to reducing the severity of substance use disorders and vice versa. IDPH linked both of these in our State Health Improvement Plan to demonstrate the importance of our contributions and approach to mental health and substance use disorder infrastructure to improving outcomes in both of these health priority areas.
And again, we'll have more coming up on this linkage of mental health and substance use disorder a little bit later on in this program. I want to turn to some of the strategies that are laid out now in the State Health Improvement Plan, the SHIP, to address some of these issues. One of those strategies laid out in the SHIP reads, quote, increase access to age-appropriate community-based care to to reduce institutionalized treatment and incarceration. The mental health of children and adolescents is getting more attention these days. So, Julia, let's talk about IDPH's role in what's known as the Children's Behavioral Health Transformation Initiative. They've launched earlier this year the Beacon portal. So, talk about that and how that assists with this strategy.
Yeah, thanks. I'll first start out with just kind of laying out some statistics that come from some of the data collection that IDPH does, and then I'll talk a little bit about Beacon and the Children's Behavioral Health Transformation Initiative. So, children's mental health is absolutely a key priority for IDPH. According to hospital discharge records that we collect, mental health and substance use disorders caused almost half of all hospitalizations of youth ages 3 to 17 from 2018 to 2022. This same data tells us that for both girls and boys, hospitalization and emergency department visit rates for mental health and substance use disorders were highest among youth ages 15 to 17 years, Black youth, and youth residing in rural counties when compared to other age, racial, ethnic, and geographic groups. Furthermore, according to IDPH Vital Records data, suicide is the third leading cause of death among Illinois youth ages 10 to 19. Although the overall adolescent suicide rate has remained stable from 2013 to 2022, suicide deaths are rising among girls, Black and Latino youth, and youth living in urban and suburban communities. So those statistics, while bleak, really do tell us that we have a lot of work to do, and our work to participate in some of these state initiatives is very relevant. The Illinois Children's Mental Health Partnership is a board that is newly housed at the Illinois Department of Public Health due to Public Act 1030885 that was enacted into law in August of 2024. This board has the role of advising the Children's Behavioral Health Transformation Initiative and other state agencies on children's mental health prevention, early in identification, and treatment of mental health issues. This partnership and the children's mental health stakeholders that we work with play an essential role in bringing data like the statistics that I noted a moment ago to life, and prioritizing programs, resources, and attention to the specific communities highlighted in the data that need it the most. So, as you were mentioning, Jim, under the leadership of Governor J.B. Pritzker, the state of Illinois has embarked on a comprehensive and coordinated effort to strengthen and improve behavioral health services for children and youth called the Illinois Children's Behavioral Health Transformation Initiative. It is a mouthful, but it does very, very important work. We at the Illinois Department of Public Health are one of the 6 child-serving state agencies in Illinois, and we assist this behavioral health initiative for children with all of its work, including most recently with the rollout of the Beacon portal, which is a portal that helps families access state and community-based health services for children and adolescents. We encourage you listeners to visit beacon.illinois.gov to access the portal. In addition to promoting Beacon as a new tool for families to use to seek care for children who have mental and behavioral health concerns, the Department of Public Health is also co-leading the work with the Children's Behavioral Health Transformation Initiative to fortify community networks across the state, which will support community-based and family-led infrastructure to support mental health and substance use disorder support statewide. So that's a lot of information that I shared, but really hope that it highlights how children's mental health is a key priority for us at IDPH.
And a reminder again, you can go to beacon.illinois.gov to learn more about that Beacon portal. I want to turn back to Melissa Stalets now, Deputy Director in the Office of Health Promotion at IDPH, about another strategy in the SHIP: improve the resilience and recovery capital of communities experiencing violence. And we know that firearms violence in particular has impacted so many people in communities around the state. So Melissa, what's IDPH doing to reduce the incidences of firearms violence, and how do we assist communities in the aftermath of violence?
So, firearm violence is a difficult and complex issue. And so, for those reasons, IDPH is taking several approaches to address firearm violence. Just this past January, we released the dashboard on firearm-related injuries in the states. The dashboard has 2 components. One is Illinois firearm injury rates, and the other is Illinois violent death. The goal is to provide information at the county level to support data-driven prevention efforts to reduce violent death and firearm injuries in the state. The dashboard, which was developed with support from the Joyce Foundation and was designed by Understory Consulting, is an important step toward ensuring that accurate data is available to policymakers, community members, and others who are positioned to drive meaningful change. IDPH also has undertaken efforts to increase awareness of firearm restraining orders. A firearm restraining order is a way for a family, household members, and law enforcement to temporarily restrict a person's access to guns and ammunition when that person poses a significant danger to themselves or others. This gives the person time to seek additional support or treatment, or time to heal. We know that firearm restraining orders are effective in reducing firearm violence, but found that awareness about them was lacking. So in coordination with Brady and the Ad Council, IDPH launched the Pause to Heal campaign last year. This campaign includes website, audio, print, and video PSAs. IDPH also supports safe storage of firearms. In partnership with the Illinois State Police and the U.S. Department of Veterans Affairs, more than 180,000 gun blocks have been distributed. The goal of this program is to prevent accidental shootings, gun violence, and suicide. We've been really pleased to see such interest in this program. And finally, with regard to helping in the aftermath of violence, IDPH is working with grantees to implement hospital-based violence intervention. This approach aims to reduce the risk of retaliation and re-injury of individuals presenting to the hospital with a violence-based injury. It starts with a brief intervention at the hospital and is followed by ongoing care, resources, and safety planning. Importantly, these supports are trauma-informed and involve trusted members of the community. I encourage any listeners who want to learn more to check out IDPH's website on gun safety.
I want to thank our guest for sharing so much valuable information with us, Julia Strehlow, Senior Advisor to IDPH Director Dr. Samir Bora, and Melissa Stalets, Deputy Director for Health Promotion at the Illinois Department of Public Health. Again, thank you both so much for being here. Now joining us on This is Public Health with the Illinois Department of Public Health, our next guest, Dr. Nicole Gastala, Medical Director for the Division of Substance Use Prevention and Recovery, known as SUPR, at the Illinois Department of Human Services. Thank you, Dr. Gastala, for being here with us. I'll ask you the same question I posed earlier in the episode. Why are mental health and substance use issues so frequently linked as they are in the State Health Improvement Plan?
Yeah, that's a really great question. So, substance use and mental health conditions frequently co-occur, so meaning that they happen in the same people. There's this national survey called the National Survey of Drug Use and Health, where they found that over 1/3 of adults with any mental illness also have a substance use disorder. Then on the flip side, 1/2 of adults with a substance use disorder also have a mental health condition. So this correlation is actually even higher for individuals with severe mental illness and for young adults. And the reason if this is so important is because when these co-occur, it's important to treat them together, right? Because patients will then have a better outcome. And so this link between these two areas is actually part of the reason why the Illinois Department of Human Services Division of Substance Use Prevention and Recovery and the Division of Mental Health will be integrating and becoming the Division of Behavioral Health and Recovery. And this will occur in July, this upcoming July. And this was because of a recent executive order that was signed by Governor Pritzker and, of course, is pending General Assembly review. But because these conditions co-occur so frequently and patients do better when they're addressed at the same time, this is one of the many reasons that we are integrating as well to be able to address this in a more holistic way.
That move toward integration really important, and it ties in directly to one of the strategies that is laid out in Healthy Illinois 2028 about addressing both mental health and substance use disorder. That strategy reads, improve the mental health and substance use disorder systems infrastructure to support and strengthen prevention and treatment. So let's talk a little bit more about this integration of those programs within DHS and some of the other changes that are taking place to make the state's infrastructure more effective and responsive.
Yeah, that's really great point. So really, again, the first example of changing infrastructure is really integrating the two agencies so that we can better address care and patients in a more holistic way, right? And so by integrating the two divisions to become the Division of Behavioral Health and Recovery, we're going to be able to provide improved services for people with co-occurring disorders, as well as leveraging the expertise of each division's staff to support and strengthen the state's infrastructure to respond to people who have either or both, right? And so, again, this framework of this integrated division is being developed and will continue to be improved. And again, around July 1st is when it'll be the official new division. And by doing this, this really also helps us strengthen other infrastructure, right? So we are building out the state's crisis response system, which includes the 988 line. So that's where you can call if someone's having a behavioral health crisis, either the person who's having the crisis, a bystander, a family member, right? And so that allows individuals who are having a crisis for someone to call, someone to respond, and a place to go. And then there's also another important aspect called the HFS Certified Community Behavioral Health Center pilots. And these are sites, these are clinical teams, these are organizations that have committed to caring for both mental health and substance use disorders together to significantly improve care for people who have mental health conditions and or substance use disorders. So these are just sort of some of those two initial. So just like we talked about changing the infrastructure of the divisions and including, improving access for patients who are entering certain systems of care, another area that's really important, in addition to 988, is through the Illinois helpline called MAR Now. And MAR stands for Medication Assisted Recovery. So it's the medications that can help someone achieve recovery if they have an opioid use disorder or alcohol use disorder. And what it does is through the Illinois helpline, you can call and get connected to a case manager and a clinician who can immediately do a telehealth visit for you, offer medications if it's appropriate, and get you connected to community care. So again, reducing those barriers to accessing treatment when you're ready to make that change. And so that's a really other important area. The last one that I'll talk about is improving infrastructure support for special populations, right, or high-risk patient populations. And another example that we have of that is supporting those who are justice involved, because the risk of overdose is so high when they leave the justice system. It's really important that they get started and maintained on medication when they are involved in the justice system, continued from the community to the justice system, and then back to the community afterwards. And SUPR has done that by convening a learning collaborative to support medication assisted recovery for justice involved populations. And this has been really critical since 2022. There's over 28 counties participating in Illinois, which has led to more than over 1,176 individuals receiving medications who would not have without this program. So by SUPR working with the Illinois Department of Corrections and the justice system, really improving care. Another significant milestone is that IDOC has now are continuing to offer medications for those who are entering their system if they do need it. And that's, I think, a really important other area. So again, continuing patients who are on medication as they enter the justice system, and then when they leave, to really ensure stability of care like any other chronic health condition. And this is really an enormous success for Illinois residents and for Illinois, since this again is a high risk patient population of fatal overdoses when they do leave the justice system.
Another strategy laid out in Healthy Illinois 2028 calls for reducing mortality due to mental health conditions and substance use disorders through harm reduction and preventive care strategies. Now, we recently had some very good news in this regard, a decline statewide in opioid overdose deaths and total overdose fatalities, and a lot of that seems to be linked to both harm reduction and preventive care. So if you could talk about each of these, define what we mean by harm reduction and how does it make a difference, and what preventive care strategies are in place.
So, harm reduction is a really important strategy that really helps people in their recovery. And harm reduction respects everyone's human dignity and provides tools and pathways to reduce harm. So, it doesn't minimize harm, it just respects the person's decision, like any other chronic health condition that we have. If someone chooses to take medicine or not, engage in therapy or not. So, this can include naloxone distribution. So, that's that medication that helps reverse an overdose, for programs that distribute safe use supplies. And these types of programs save lives and give people the opportunity to find a path to recovery when they are ready. And really, the stigma associated with substance use can be a significant barrier for people who use drugs that may keep them hidden or on the fringe of their communities and families. So, harm reduction services are provided without judgment and with the intent to form a supportive relationship that can provide information and present options that can reduce harms associated with drug use. So, the purpose is really to meet people where they are at, listen to them as agents of their own lives to be directed by them, while being able to provide services and referrals as they decide when they want. So, just a really important strategy, and which has led to this reduction that we've seen in overdose deaths in the state of Illinois and countrywide.
We've covered a lot of ground here and so many programs and services that are available for people who are dealing with these issues. Is there an easy place for people to go to learn more about these services and how they can access them?
Yeah, I would say that our state website is incredibly helpful. You can find information for 988. You can find information on NAR now, as well as the Illinois helpline. The Illinois helpline you can also access via text and phone call, as well as you can with 988 as well. So, really, just important, I think, areas and opportunities to support patients. There's also opportunities to get in touch with your local programs, right? Overdose prevention trainings, as well as being able to obtain naloxone and other harm reduction supplies for your communities.
Dr. Nicole Gastala, Medical Director for the Division of Substance Use Prevention and Recovery, SUPR, at the Illinois Department of Human Services. Thank you again for your time. Thanks for being here with us. And thanks to all of you for joining us here. Please be with us next time for another edition of This is Public Health with the Illinois Department of Public Health.